in honor of April Rosacea Awareness, can you just start off and tell us, like, what is rosacea anyway?
Okay, so I'm going to start off with some stats and some just general information. But first of all, rosacea affects over 16 million Americans, and
Wow.
those numbers are actually really a lot higher than that because, well, how do you know if somebody has rosacea unless they've gone to a doctor and it gets reported? So there's a lot of
True.
people that have it and complain about it, but they haven't seen a physician. And some people just think they have acne or that their skin is red. And it used to be called acne rosacea. That's
Right.
actually two different conditions. We'll get more into that. So
Okay.
acne is a condition, rosacea is a condition. But you can have acne and rosacea present at the same time. But the lesions that look like acne, those are not acne lesions.
Okay.
And typically the onset of rosacea is between the ages of 30 and 50.
Hmm.
And it is, it can happen when you're younger, but you just don't see it as frequently. It can happen when you're older than 50, you can have the onset of rosacea. But that's the general age range. And it usually affects fair-skinned people. Now, I have seen individuals that have more pigment in their skin with rosacea. I've even consulted with a fair-skinned African-American physician, but generally it's going to be fair-skinned people.
Wow. That
And
makes it rough.
also, it affects women more than men. And when a man gets rosacea, oftentimes it's more aggressive. We don't really understand the difference in terms of why it affects men the way that it does. But in general, it tends to be more women than females.
Does that mean it's hormonally related then, or?
No, it has to do,
Okay.
I'll tell you, and we can get more into this,
Okay.
but one of the primary causative factors of rosacea is something called vasomotor instability. It's a chronic inflammatory disorder. And so your blood vessels are designed to expand and contract, expand and contract. In rosacea, those blood vessels are compromised. So one of the primary characteristics that we see is we see redness. And we also see dilated capillaries that are known as telangiectasia. Now, a lot of times people call them broken capillaries. If they were broken, you wouldn't be able to see them.
Oh.
But they're dilated. So they're telangiectasia. Now, you can get a little telangiectasia around your nose. It's mainly just sun exposure. But in general, the area with the telangiectasia is usually through this
Right.
area. And so rosacea is, has a lot of different aspects associated with it. And, we'll get more into that.
Okay. So you've kind of gone through some of the characteristics, but when you mention up here, you kind of hear sometimes about that butterfly pattern. So is that a normal pattern that we see, or?
The butterfly pattern actually is something that's associated with an autoimmune disease,
Oh.
which you get what's called a butterfly rash. And I'm trying to think, it's not, it is, it's going to come to me later, probably when I don't need to know it. But it affects a lot of younger females, usually around the age of 30 and up. And when they're having an active
Flare up.
flare-up, then it tends to flare up in a butterfly pattern. But rosacea, it just happens to be where there's a lot of vascularity. Now, sometimes people actually flush and blush and they actually get redness
Right.
into the scalp. Occasionally it goes down to the neck and into the chest, but this
Oh,
is
wow.
generally the area.
Okay. So is it inherited? Is it a hereditary?
Well, actually, yes and no. So we haven't found the rosacea gene. So there's not like a
Okay.
specific gene that says, okay, this person was born with this gene and they're going to get rosacea. You inherit your skin type.
Right.
So if you have fair skin, you inherited fair skin. And the reason that fair-skinned people are so susceptible to rosacea, because one of the primary causative factors is sun exposure. Anybody that's had rosacea, they might say, well, I was never a sunbather. I don't care. You had cumulative sun exposure, and because you're fair skin, that UV radiation affects your skin and compromises it much more so than someone with darker skin. So you inherit your fair skin, and that puts you at much greater risk for all that damage that takes place, passive dilation, all that damage that takes place to your collagen and to your vascular structure that results in rosacea.
Right. Which makes sense because a fairer skin is obviously, just by nature of the color, is going to tend to get more damage. So again, so important for sunscreen. That's wow.
Well,
That's
here's the other thing that's a big misconception. Rosacea is not a disease of sensitivity. It's a disease of reactivity. And
okay.
it's very different. So you could have really sensitive skin and not have rosacea. You could have rosacea and not be particularly sensitive to topical agents. You are reactive, and there's certain triggers that cause this reactivity. So, for example, some people it's alcohol. Now, I had a sister-in-law that she could drink white wine, but when she drank red wine, she flushed, she blushed, she really got a flare-up.
Wow.
Some people, it's spicy food. That's a very common
Yeah.
trigger. Or it could be caffeine, or it
Right.
could be chocolate.
Right.
Berries, avocados, it can be different things for different people. It can also be really cold weather, really hot weather, humid weather, sitting in a stuffy room, stress, not getting enough sleep. Everybody's triggers are going to be a little bit different. But when we talk about these triggers, this kind of relates to one of the primary causative factors. So you've got all these things going on. You have the sun exposure, the sun damage, you've damaged the vascular structure, passive dilation. It's all these things that are going on. But one of the biggest causative factors that plays a role in this is something called the kisolicitin protein. So
Caseolacin protein.
you have this protein that's very inflammatory, but actually it's a good protein because it plays a role in wound healing. So you wound yourself. You have something where you've compromised, your skin in some way. This kisolicitin protein is going to be very helpful. It's necessary. But if you're producing it for no reason at all, it's a
Oh.
major factor in the rosacea sort of syndrome, if you will. And so it's not necessarily the demodexamide. That's never been proven. That is one of the primary factors. So when